Any comments from the panel? Hugo, any comments from you?
Well, I think this is a very nice example, very nice video, in which we have to know very well familiarized with the instruments you are using during surgery. I don't know if these scissors were disposables or were not disposables. Have you used several times? What you learn from this?
No, these are reusable scissors that you have a common handle and interchangeable tip, so you can change it with a vertical, horizontal scissors. It's reusable 23 gauge.
Okay. Well, that is a way that to prevent it. If it is reusable, you have to be aware when these are not working. Obviously, you never know when this is going to happen. But I think what we should learn is sometimes probably would be better to use disposable versus not disposables.
And I think in the US, that is the most common practice, as most of us are using disposable instruments. I think the key is always inspect the tip of your instruments, and also usually at the end of the surgery, also inspect the back of the eye. One question I have for you, Khaled, what about removing the trocar? I think that if you remove the trocar, the sclera is usually a little bit more flexible, and maybe with a little enlargement of that sclerotomy, you may be able to just pull that forceps out.
Yeah, but you saw the blades were wide open. You probably need to extend to 3 at least millimeter.
Yeah, but because it was a V-shaped, you may be able to still, because the choroidal tissue and the sclera is a little bit flexible, so you may be able to remove. One other issue that can happen is also, that I've been seen happening, is that the tip of the soft tip is lost, and that can happen even with the regular disposable soft tips. If that happens, and usually if you use the soft tip during the air fluid exchange, and suddenly the tip is dislodged from the instrument, what you want to do is go back into fluid. You don't want to fill the eye completely, but just halfway. That tip of the soft tip will float in that fluid and allows quite easily removal of the instrument. But again, emphasizes the importance of inspecting the tip of your instruments during the surgery so nothing is left. And if anything is left, obviously these need to be always removed because of the risk of siderosis.